As Paul Makin reports, it's feared it can happen to kids as young as 4 years old, and mums and dads can do nothing to stop it.
Guys, I'm sorry, he needs to come with take your hands.
Frightening. Absolutely frightening.
Take your hands off him, sir. Thank you. I'm his father. It's all right, Luke. I'll come and see you.
The Act actually means that they can, by law, now detain your child. They can take your child away without your permission, without your consent.
If you're a parent of a child with behavioural problems, you could be in for a rude shock.
Come with me.
They can actually put them in a hospital, they can medicate your child, they can actually restrain your child.
We're not talking about Cold War Russia here, we're talking about South Australia.
I don't think people grasp the enormity of what the consequences of this bill could be for them.
I would describe it as just inhumane.
The phrase draconian comes to mind.
Sounds like it's something from the Dark Ages, doesn't it?
It's very real.
Changes to our Mental Health Act passed by both Houses of Parliament come into force in 2010. And it will give doctors, psychiatrists, even police carte blanche powers to detain your child.
Any power, including the power to use reasonable force. The treatment may be given despite the absence or refusal of consent to the treatment.
Under these rules, children as young as 4 can be taken by force, drugged, and even worse.
They can be given ECT, electric shock, 460 volts to the brain.
ECT produces a seizure, which needs to last for 25 to 120 seconds to be a good or effective treatment.
Electric shock could cause memory loss, it could cause brain damage, and in worst case scenario, it could cause death.
I do believe that the government thinks it is the best parent.
Independent MP and drug treatment reformer Anne Bressington tried to intervene in the Legislative Council with amendments to this bill, but the government was having none of that.
I basically met with the minister and was told that those amendments wouldn't be supported. Most of my amendments were around the prescription of A.D.D, A.D.H.D medications to children younger than 12, and was told that that was an issue for the Controlled Substances Act.
More and more kids are going to be medicated. There are all sorts of amphetamines and antidepressants that kids can be given.
But is drugging our kids the answer anyway?
There are a lot of children who are diagnosed with A.D.H.D who go on a comprehensive elimination diet and their symptoms go away.
Let's see if we can figure this out for ourselves. Let's look at diet. Let's look at a more holistic approach.
Lillian Reiki is the author of The Revolting Child, A Blessing in Disguise, which explores other ways to treat attention deficit hyperactivity disorder, other than drugs like Ritalin, which she refused to give to her own son, Caleb.
So we said, thank you very much for your advice, but no thank you.
So instead of Caleb ending up a Ritalin kid, Lillian looked to the food he was eating.
We've been working very, very hard with him over the years with diet, with nutrition, with positive attitude and so forth, and we've had some great results.
I think I could be a lot worse right now if we had taken a different approach.
The trouble is, according to the experts, the tag ADHD is slapped on kids all too quickly these days.
I think that there can be many reasons for bad behaviour, but I think that one of the reasons that you've got to look at first is the effect of foods.
Sue Dengate is an expert on the effects of food chemicals on children's behaviour and says the jury is in when it comes to ADHD.
In my experience, ADHD is overdiagnosed. I think that it's misdiagnosed when it's really food intolerance a lot of the time.
And the culprit can be food colours and preservatives, something you may already know. But what you probably don't know is the food companies are now using smoke and mirrors to disguise the additives.
Food manufacturers are aiming towards producing food that's got what they call a clean label, no nasty numbers on it, but it can still affect children's behaviour, and parents have no idea.
No numbers mean we're none the wiser.
Food is worth billions of dollars, and that's the priority here in Australia at the moment, is to protect the food industry at the expense of the consumers. As one father said to me, what do we want? Do we want bright colours or bright kids? I think we should be protecting our kids.
And Sue says she has inside information that the strings are being pulled from Canberra.
Well, I've been told unofficially by somebody at our food regulator, she said, the food industry has powerful friends in Canberra. We are afraid for our jobs. That gives you some idea of what's going on, doesn't it?
Meanwhile, for South Australian parents, Big Brother could take that problem child off your hands in 2010.
Some kids that are diagnosed with ADHD could end up being snared by this government net.
Absolutely.
Mental Health Minister Jane Lomax-Smith declined to be interviewed. However, Health SA's Dr Margaret Honeyman says she can't understand why Anne Bressington would make these comments and that existing legislation will protect children. On the use of treatment on children, Dr Honeyman says only one person, a 17-year-old, has had ECT treatment in the last 5 years. That's no comfort to South Australian parents.
We're going to have more and more kids drugged out on these amphetamines and antidepressants, and it's not the way we want to go. We don't want a future of children, drugged out children.
The first port of call certainly should not be an introduction to our mental health system for your children.
So get in before the government does.
Absolutely, and avoid this system at all costs.
He's trying to take your hand. Take your hands off. I am his father.